Expats News. We're coming live to you with our 6th broadcast from Bangkok, Thailand. Please come in. Make sure you comment below and tell us where you're watching from. We've had some really cool feedback from different places from around the world, so we're interested to see it in the comment section. So whether you're from the United States or here in Asia, good morning for those of you in Asia. Good evening for those of you watching from the United States and western part of the world. So let's get settled. All right, we are beyond excited to be doing our 6th broadcast of Ebony Expats News. This means for 6 weeks we have worked to address things that affect Black travelers and expats. We've brought you news that keeps you updated, informed, and engaged through our global network of Black travelers and expats. So we just want to take a moment to say thank you so much for watching, and we hope that you keep watching. Alrighty, so if you don't know me, I'm your host and political correspondent here at Ebony Expats News. My name's Liana Freeman. And today we're going to talk to you about global news. We're going to bring news as it pertains to Black travelers and expats. We're also going to talk about global shortages and how quarantine has highlighted some of the world's most vulnerable and high unemployment rates. And then lastly, we're going to talk to you about an interview that Ebony Expats was very privileged to do with the United Nations Regional Health Director and Migration Director, Patrick Dugan, who answered all of our questions about coronavirus. So let's go ahead and just get started bringing you news from around the world. So there were so many news updates this week. It was nearly overwhelming. We had the Pentagon, which decided to release footage of UFOs. We had global protests, world economies taking a nosedive. And so there was quite a bit of sorting to figure out what things we wanted to bring that were relevant to know, especially if you're an expat living abroad or for whatever your reason you're in a country different from your own. And just dive all into it. So let's go ahead and do that now. So our first stories tonight focus on the COVID-19 related medical achievements. Yes, finally some good news. According to CBS, there are about 70 vaccines being developed around the world, but Oxford has proven to be one of the most prominent, as prior research on other viruses means that there has already been prior work underway on a vaccine. So Oxford began testing on monkeys, and after the monkeys showed resistance to the virus after being exposed to heavy doses of it, they were cleared for human testing, which started this week. Oxford's very hopeful about this vaccine, and they're hoping to have it available as early as September. Conversely, in the United States, the U.S. Food and Drug Administration has issued an emergency use order for the antiviral drug remdesivir, which is used to treat critically ill coronavirus patients. In a few patients, the drug has shown to cut recovery time very significantly. But the FDA was quick to clarify that an emergency order for use of the drug is not the same as FDA approval. The drug is not approved by the FDA because there hasn't been sufficient testing to substantiate the claims that it helps patients recover more quickly, and doctors are largely unaware of the side effects. This fact has caused many medical professionals in the United States to caution the public not to celebrate remdesivir as a medical breakthrough. This was articulated best by Dr. Stephen Nielsen when he said, "A full study hasn't been conducted. We haven't had the time to study the side effects. An emergency use order, isn't the same as approval. We have to ask ourselves, does it have improved chances of survival? Does remdesivir do any harm?" It's important to note that the US FDA acted after preliminary results showed in a government-sponsored study that it shortened patients' recovery time to about 31%, or about 4 days on average. Although countries like Japan, as well as other countries, are testing remdesivir, It has not been licensed anywhere, or it hasn't been licensed or approved anywhere globally. So that's something that definitely deserves to have a stake in the conversation. This coming just after 30 states, or over half the United States, has either decided to reopen the government or ease lockdown restrictions, even though, and get this, even though on average 2,000 Americans died every day last week from coronavirus related complications. And the World Health Organization reports that the United States saw its worst day on April 30th, recording 2,909 deaths. Okay, so some good news out of Thailand. If you already live here, you probably know. Thailand was one of the few countries in the world with an alcohol ban that started on April 10th and ended on May 3rd. So hundreds of people rushed to the stores and to stock up on alcohol, leading a lot of people to speculate if provincial governments will reinstate the ban to curb large crowds and panic buyers. So far, so good. So far, that hasn't been the case. Alrighty, and according to the BBC, the European Union, or the world's largest economic bloc, has shrank at the sharpest record at 3.8% in the first financial quarter, making it the worst financial crisis the European Union has seen since 2008. In fact, France reports the worst economic shutdown since worst economic slowdown, since World War II. All right, according to Al Jazeera, countries are ramping up their requirements for citizens to wear masks on public transportation. Countries like the Czech Republic, Jamaica, Germany, Morocco, Bosnia, Turkey, and Slovenia are just a few that are requiring all citizens to wear masks while using public transportation or risk being refused service. Alrighty, so some news out of Malaysia this morning. Much like Guangzhou, China, there's been a growing notion in Malaysia's capital of Kuala Lumpur that undocumented migrants are to blame for spreading coronavirus. In response, authorities have raided several dwellings containing over 700 men, women, and children and taken them to detention centers where they're kept in very close quarters. Police chief told a local news outlet it's to prevent undocumented migrants from traveling around the country and spreading the virus. However, the United Nations called for the immediate risk of children and vulnerable individuals from detention camps where they're being held. Phil Robertson, Human Rights Watch, tweeted, detention is worsening the risk of pandemic in Malaysia, both in terms of potential outbreaks, but also making undocumented people less likely to cooperate. Alrighty, and our last story presents a bit of a silver lining during these chaotic times as the environment thrives. Cleaner air and water have been a positive effect of quarantine. According to a report done by NBC, pollution has dropped anywhere from 10 to 30% in some world cities. Within a 2-week period, pollution dropped by 30% in the Bay Area, California region, as well as large industrial parts of Italy and Chinese cities. According to National Geographic, China's coal use has dropped by 40%. And there is a resurgence of wildlife around the world. For instance, in Ebony, our location of Thailand, 50 bottlenose dolphins were spotted just outside the coast, the largest group that anyone in the area has seen. Yet climate scientists are very quick to warn us that governments need to make a priority to shift towards sustainable options, or these dropping rates that we're seeing will continue to rise. Also, addressing climate change now, or slowing climate change now, means less risk of preventable diseases in the future. Alrighty, so that wraps up our news for today. A note from Ebony Expats this morning. We wanted to address global shortage and unemployment. Ebony Expats is here to bring you news to keep you updated, but also to bring perspective, as so much information rushing to you at one time can be not only hard to differentiate or hard to use to form some type of informed opinion, but it also creates a sense of desensitization. Excuse me. If you don't know how to make sense of it. So we're going to talk a little bit about the economic impact coronavirus has had on the world. So it occurred to me this week after doing research, seeing footage of protests around the world. It's not just the United States. It's primarily, but it's not just the United States. And documentaries on how COVID-19 have affected the world's poor. That I started to realize just how many people this puts in a dire situation, both in developed nations, but where people face insecurity, food insecurity, and homelessness. Actually, according to the United Nations, 1 out of 10 people on Earth are living under the global poverty line. This means that their earnings are $1.90 per day or less. And according to the International Labor Organization, almost half of the world's workforce, 1.6 billion people, take that in, 1.6 billion people are in immediate danger of losing their livelihoods and having their livelihoods destroyed. So many people around the world are faced with the tough choice between defying stay-at-home orders or going without food and shelter. And this is very much so inclusive of Western countries like the US, where 30 million people have filed for unemployment. These photos in San Antonio, Texas, is what I decided to focus on, because this just shows the amount of desperation and the amount of shortages that have been caused by amount of shortages and economic instability that has been caused by coronavirus. What you're seeing are photos of people lined up at a local food bank just to be able to put food on their tables. And so representatives working for this food bank in San Antonio said, we absolutely do not have enough food to feed all of these people. So this week has done a really exceptional job, with no positive connotation at all, of shining light on just how many people live in societies without proper social welfare programs, universal health care, or financial assistance. And so they're placed in a position where they may catch coronavirus, but they absolutely will not have food to put on the table if they don't go back to work. And I feel like travelers fall on this spectrum, where many of us were privileged enough to travel abroad or privileged enough to move abroad, secure work, and perhaps find a better lifestyle than we would have had in our respective countries. However, this is a spectrum. There are also expats who were planning on moving home, and travelers who were stuck in other countries. So we definitely fall on a spectrum, but it is our job as an expat to keep a close eye on world dynamics, just so that we understand how to better navigate the spaces that we're now taking up as foreigners in other countries. Alrighty, so our last segment today talks about an incredible interview that we got to have with Patrick Dugan, who is a regional migration and health advisor at IOM for the United States Migration. In a 20-minute interview, we asked him a plethora of questions related to coronavirus healthcare, everyday routines, the differences in masks and their protections, and most importantly, what we can kind of expect going into the future with COVID-19. This interview was quite long, so we aren't able to show it on this particular broadcasting, but we will have that interview up on the Ebony Expats page today. Please make sure to tune in, because there was a lot of information that I even learned, even researching and preparing for this interview, questions I didn't even think to ask. So it's definitely a really good source that we have, and even more exciting that we got an Ebony Expats exclusive. Alrighty, so this concludes our episode of Ebony Expats News. Please share your takeaways in the comments, anything that surprised you, And let us know if you are an expat in a very interesting situation, or you have been stranded because of coronavirus related lockdowns. Please let us know. We would love to interview you and have you on the show. All right, have an exceptional day, and we'll see you this time next week.